تجري من تحتها الأنهار خالدين فيها أبدا رضي الله عنهم ورضوا عنه ذلك لمن خشي ربه.
تبارك الله. تبارك الله.
MashaAllah, if I was the judge to give her some points out of 10, let me think how many. I think my mind and heart is telling me I can't take away any point. 10 out of 10. MashaAllah, excellent, excellent. So brothers and sisters and my sons and daughters who are young people here, we have this mental health workshop, and I will introduce that. This will run from now, which is 1:30 up to 3:30. And in between we have a break for Salatul Asr, and that is the time we can also, refresh ourselves, take a break, and have a tea, coffee, or drinks, or little refreshments provided by the mosque committee, and I'm grateful to them. Today, remember, who are the most important people today? It's not me, it's not our expert guests, it is you. Because you are the most important people, because you have taken time out of your busy lives and you wish to either discuss something or learn something for your own self, for your relatives, for your loved ones, or just for the community service. So all what I can say is, may Allah subhanahu wa ta'ala put much barakah in that and increase your knowledge. And it's important that we learn about mental illnesses, because 1 in 10 people at least have a clinical problem, but in reality it is more than that. If there are 10 people you see around, and you'll find 1 in 10 might be seeking help and treatment, but there are other 2 or 3 people who have a problem and they're not coming up. And Dr. Sultan will discuss that. And it is a great burden on the governments, great burden on the society, and it's also a great burden on the families. Why it is a burden? Because people don't seek treatment. So if you seek treatment and seek help and accept it, and we have to go against our own internal denial, we need to negotiate ourselves. We take pride in negotiating with him and her and that and this and other. But the most important negotiation you will do ever in your life is with your own self. What shall I do and what I shall not do? So in this case, there is no stigma. Like people have other problems, diabetes and heart problem and liver problem, kidney problems and many other problems in life. So mental illness is very common. But one should not be frightened of it, because most of it can be discussed and it is treatable and manageable, and people can. There are very few people actually who will require a high level of treatment. And it will be a test for all of us in the families to look after them. So Dr. Sultan will touch on that. Now coming to the program, I will be controlling this time management. This is what we call. I might have to be sort of little reminder for these 2 experts, and also remind you of the time. And if they overrun time, so I will have a code signal and hope they will understand. I hope you understand the code signal. We agreed with that ourselves.
Very useful.
Yeah. Before I start, I also need to, this all is not happening just because I'm here, Dr. Javaid Sultan or Dr. Bassam Saleh is here. It's not happening because of simple, we want to do it. It would not have been possible if there were no help from the IT people. It have not been possible, no help from the JMIC Islamic Center, the Istanbul, their committee have not agreed with that. Fahim has been working, Wasif has been working, Amir Mirza has been working, Ikram Sahab has been working, everybody, Latif Sahab in the background, everybody has allowed us to do this program, so we should pray for them. We only forgotten how to pray. We only pray for ourselves and children. What about other people? who are doing a community work, and Langley Islamic Center Executive Committee and all our brothers and IT team, they have been working hard to make this happen. So please remember that. So it is not that I want appreciation or doctors want appreciation. It is everybody. It's a joint work. This is the beauty of the joint work and working together. So program today, first of all, this is introduction, which is finishing soon. The first presentation will be by Dr. Javaid Sultan, and it will last about 20 minutes. And he will touch on, he will just scan through the mental health problems. Don't ask any questions yet. We will have a question answer session soon after that. So soon after he makes the presentation, if we have a time, we will do a multiple choice questions. It will be a little game and fun. And I hope we like it. So it's not a game and fun which cannot be played in the masjid. It is just a learning fun, and I think Dr. Javaid will have to manage the time. Dr. Javaid Sultan is a consultant psychiatrist for at least, if I'm wrong, correct me, about 15 years or so. And he is working Reading area, Maidenhead area, now in Slough, New Horizon, and he is the chairperson for Langley Islamic Center. So dedicating his time, taking away from his families, from his elderly parents and he is the chairperson of that committee. They are committed to establish inshallah ta'ala in Langley Islamic Center, which will be just like a sister of this mosque, completely non-sectarian. We will be building this mosque. I'm also part of the committee, the executive committee, on taking lead from this mosque and some components of Al Jannah Mosque. So people should also, if not now, some other time, remember they got a charity, registered the charity a few months ago, to ask people to donate for them, ask people to help them. That's extremely important. Then we will have a break for Asr at 2:25. We come back in 20 minutes time. And then at 2:45 we have a second presentation by Dr. Bassam Saleh. He is from Middle East. He speaks the most beautiful Arabic. He is Hafizul Quran. He is not a psychiatrist. And he is a urologist. Please don't ask any questions about urological problems, because today is not the day. It is about the mental health. He is our teacher and sheikh, because he is imam at the same time, working full time, got a wife and children. He is also part of our executive committee. And he will make a small presentation how the faith, whether it is our faith, Islam, but other people can have their own faith. If there are any non-Muslims here, they're Sikh faith or Hindu faith or Jewish or Christian, that's their faith, that's fine. Faith is, the research have shown over a period of last 70 odd years, it is a protective factor. It protects you from mental illness. If it not from happening, but certainly helps you to how to cope with that. And he will bring, inshallah ta'ala, in a very brief time, some beautiful examples from our religion that how to cope with that. Cure is in the hands of Allah subhanahu wa ta'ala, but he will mention that this is his task. So today he's not a urologist. Are you a urologist today? No. So he will talk the spiritual treatment or guidance or signposting regarding mental health problems or distresses we feel. Whole Muslim Ummah is actually suffering from, I call it OTSD. You must have heard what PTSD, which is post-traumatic stress disorder. But what's happening with the Ummah, I call it OTSD. It's my terminology. It's ongoing. All Ummah is traumatized at the present moment. What's happening in the world? And what are the laws happening in this country? And many other factors which is not the remit of today. So the final session when Dr. Bassam Saleh, when he finishes, we will have a panel discussion. In panel, these two people will be here. Any spiritual problem, aspect or question will be directed towards Dr. Saleh. Any modern mental health issues, depression, anxiety, bipolar, something like that, all question will be directed toward Dr. Javaid Sultan. And I will just be around if somebody have any odd question I may be able to answer all these questions, but if anybody want additional answer about any, addiction problem, any gambling problem which is becoming rife in, or video game addictions, or any kind of addictive problems, I may be able to answer that. So without any further delay.
Sorry, I just saw the timetable. You mentioned Dr. Bassam's presentation will start at 2:45. That's the Jamaat time.
Okay, we can adjust it. It's not 2:30?
It's 2:45.
Okay, we can adjust accordingly then. Jazakallah for reminding. And human beings will always make mistake. If we wake up in the morning with the two objectives, I'm a human being, will make a mistake. So try to overlook other people's mistake. And if you make another secret intention every day, you will benefit. And you will remember me maybe for the rest of your life. Every day make a secret intention that I'm going to learn something today. Wherever the knowledge is, just go and seek knowledge. Are there any brothers and sisters who belong to other faith? No. Over to you, Dr. Javaid Sultan. So slight adjustment in the time, I will monitor that.
Can people hear me? Can you hear me?
No.
Hello, test. I think you must have switched off.
Sorry, technology.
If the machine is switched off, I hope you are not switched off.
I will not switch off.
All right, okay. It's working now.
Okay, can you hear me now? Thank you very much. Okay, I'm rather happy because we have longer time for the mental health session now, because Cypria's brother just pointed out is at 2:45. Thank you very much for that.
My face.
Yeah. Okay. Well, I think first of all, on the behalf of Langley Islamic Center, I would like to say a big thank you to Jamia Masjid, so giving us the opportunity to present ourselves and also having a direct contact with the community. So I think it's an opportunity for making ourselves feeling present in the locality, in this area, and also telling a little bit that what we are doing. I think Dr. Chaudhry has generously described our aims and objectives, that we want to build a mosque in the Langley area. So I'm one of the lucky ones who is one of the trustees and also chairperson for Langley Islamic Center. So we have a dedicated team, as Dr. Chaudhry mentioned. So let's focus today on the workshop, which is obviously the talk, and that's why you are here. It's about mental health. So I think it's important for many reasons. Some of the talk, Dr. Chaudhry has already mentioned a few things, what I was going to speak about. In the mental health workshop, we would like to make it a little bit interactive if possible. So it's not necessarily just slides and just running through the slides. So I think the question answers will be one thing which will make it more interactive. I will make some presentation and slides I have prepared for the MCQs, which will keep your brain working. So it'll be a little bit brainstorming exercise as well. So I may ask you some questions, but please don't be offended that if it is something which you don't have the answer, you can just skip it. Okay. So coming to the topic, as Dr. Chaudhry mentioned, it is something which is all there in the community, but people find it difficult to express themselves or to admit it that they have mental health issues. So let's move on. This is me. I'm working as a consultant psychiatrist in this Berkshire Foundation Trust for last 15 to 16 years now. But I have been a psychiatrist for last 22 years in NHS. So I can say I have some experience in mental health. I am also an educational and clinical trainer for Oxford Deanery, students and psychiatrists who get training. And of course, I'm chairperson now, so for last one and a half year now. If we talk about mental health, there is no health without mental health. There is no health, and this is not my slogan. this is a slogan which is given by General Medical Council, Royal College of Psychiatrists, Department of Health. There is no health without mental health. So mental health definition, if it is not included in your health is not complete. Okay? And what is health? Health is a state of complete physical, mental, and social well-being. Now I will focus more on the mental and social well-being because we know about the other aspects of the health, which are physical health. You go to the GP, you go to different specialists and different surgeons, different physicians for your physical problems. But the mental health is slightly different because for various reasons, which we'll talk about in a minute. And mental health talks about what? It's lots of things in mental health as well. It's not just simple thing. It's emotional well-being, social well-being, psychological well-being. All these aspects, how you feel, how you react, how you behave in different situations, in different scenarios. So that's important. That makes you someone who have sound in mental health. So you cannot really separate mental health from the health. That's my point which I want to raise. Okay, so as human beings, we have different dimensions. Physical dimensions, which includes our structure, bone, muscles, everything. Emotional dimensions, we have different feelings, of course. We have love, we have grief, we feel sad, we feel angry, we run from the situation sometimes because of different kind of fears in our mind. Psychological dimensions, which affect our mood, our behavior, and all those things. So this is also something which is a dimension in human beings. Spiritual dimensions, if we have faith, we are closer to Allah subhanahu wa ta'ala. Being Muslim, we can say that. Other religions also, they can be very close to Allah subhanahu wa ta'ala as well. They are, and some are, they don't believe in Allah subhanahu wa ta'ala. And believe me, in my practice, the people who are much closer to any faith, they are much more stronger as compared to people who are not very close to faith, because they don't have anything to cling upon. So because they don't know what to do. Okay? And intellectual dimensions, how our mental faculties work, how much is our intellectual ability, how is our IQ level. Everyone works at a different level. Okay? So people see things in a different perception as well because of their intellectual abilities as well. So that happens. As I said, mental health, there is no health without mental health, and this is, obviously you can't have a full globe, but the mental health is everywhere. The problem with the mental health issue is everywhere. There is no area in the world which doesn't have any mental health issues. Some areas might have more, the others have a little bit less. There could be different types of mental illnesses in different areas, in different countries, different subcontinents, but having said that, that does not mean that they don't have any mental health issues. Everywhere it is. This is just mentioning about the whole society. All age groups, all kind of different races, everyone, this is children, adolescents, adults, older people, everyone is vulnerable to have mental health issues. If there is no proper support, there is no proper treatment guidance.
Keep the mic close to your time, please. Okay. Put in the pocket.
Okay. Generally speaking, mental illness is, as I said, I think I made my point a little bit clearer that it is common, it's everywhere. 6 in 10 women will have some form of mental health issues. But generally speaking, 4 in 10 people will suffer from mental health issues. So which means 25% of the whole population will have some form of mental health problems, which is quite common. It's not something which you can easily ignore. The problem is accepting it. Okay? It can affect any of us, and it is in everywhere, every society, every religion. Here are some facts which I have mentioned, and the facts are taken from the WHO, which is World Health Organization. It's not just unique to UK. This is for the world. Okay? Around 20% of the world, children and adolescents, they have some mental health problems. So this is, we are talking more than 10%, 5%. This is, we're talking about 20% actually will have some, children will have, which is underreported as well. They will not even come to any attention. Mental and substance misuse disorder are the leading cause of disability, which leads to what? Which leads to working life disruption. So you wouldn't really work. So you will be jobless as well. So that will be again burden on the society. So that causes huge disability. Third fact is quite alarming actually, that 800,000 people every year commit suicide. 800,000 is not a small number. Worldwide. And some countries which are very, very advanced and developed countries, they also have the highest rate as well. In Europe, for example, Finland is one example. Okay? UK in 2017, I think you would be really surprised to hear in UK in 2017, more than 5,000 people committed suicide. This is not a small number. That means 15 people every day. So and now it is debatable what leads to their act of committing suicide. And that obviously happens due to many reasons. War and disasters has a large impact on the mental well-being. It can also, mental disorders are important risk factors for the other diseases as well as unintentional and intentional injuries. So if you are having some mental health issues, you will tend to ignore your physical health as well. So that's why it's very, very important that you should be looking after your mental health. Because if you are not bothered, or least bothered, you wouldn't really look after your physical health either. Social well-being, because you will be more isolated, you would not really like to communicate with people, so you will feel that you wouldn't even bother to go to your doctor, your GP for your physical checkups. So mental disorders leads to other things. Stigma and discrimination. This is something which I really want to make my point very clear. And that's one of the reasons why I wanted to present here, and I was given this opportunity, that our community does not come forward. Our families do not accept that we have mental health issues. And if they don't accept, they obviously suffer in silence. And if you suffer in silence, you obviously you are affecting your health. And health as a broader term, which is mental health and physical. Okay. Human rights violations of people with mental and psychosocial disability are routinely reported. So human rights violation. Globally, there is a huge inequity in the distribution of skilled human resources for mental health. We are lucky in this country that we have proper system here for the mental health services and teams. Think about our country back home. There are hardly any psychiatrists. Here, you can say that, at least the services are well set up. You are not coming forward to address the problem. But back home, there is hardly anyone. There is 0.1 psychiatrist for 100,000 population in Pakistan. Can you imagine? 100,000 people and half a psychiatrist. And here we have 170 psychiatrists. I'm just talking about psychiatrists. Of course, psychiatrist is not the only one you go for in getting some help. There are lots of other team members as well. Community psychiatric nurses, social workers, occupational therapists, psychologists. There's properly set up teams here, which are lacking in other parts of the world. Financial resources to increase services are relatively modest. So this is generally speaking, because this is a WHO statement. Okay? Obviously, we also have a similar issue and problem in this country as well, but it's relatively better than other countries which are developing countries. And there are 5 key barriers to increasing mental health services availability. One is that it is not on the public health agenda. One is that there is limited resources sometimes, and some services are highly specialized services which are not very well developed. People are having stigma, and people don't really, and people discriminate as well to some races and some ethnicities, so that happens. This is also a known factor. I have just put this picture on with, of one of the famous person. I think the youngsters would know that this is, he is a comedian, writer, and he is, of course, actor as well. Stephen Fry. So he suffers from bipolar affective disorder, but he accepted that this is a mental health problem he has. So he openly discussed these things, and just to make people aware that this needs to be addressed. This is not something which you should just ignore it. Now let's focus on the mental illness and the mental health issues, how it can present in different ways. It presents in different ways, and as we discussed, mentioned before, there are some psychological symptoms, some biological symptoms, some are symptoms which are in relation to your memory, concentration, which we call it cognitive symptoms. Some are more severe form of symptoms which we can call psychotic symptoms. Okay, I'll talk about that as well. What do I mean by psychotic symptoms? Because some people might not be aware of them. And then some issues with the communication, speech, and language. So these are the main salient bullet points I have put it. So people present in different ways. Their mood can change, they can be irritable, they can be sad, fidgety, nervous, and obviously that affects their day-to-day routine. The sleep can be disturbed, appetite can be disturbed, either not eating or eating more. So that also, these are the things which people can present with. Attention, memory, concentration, all can be quite disturbed. In psychotic symptoms, this is something which I would like to say a little bit more than to make it aware, to make you aware that what it can be the presentation like. People can get paranoid, can be deluded, and hallucination. These are the scientific terms. But the hallucination basically means that someone is out of touch with reality, in simple words. Okay? So he's seeing something or sensing something which is not there. And this is usually because of the chemical imbalance in the brain. So some people will start believing something which does not have much relationship with the reality. So that can lead to a delusional ideation. Okay? And generally speaking, in the community, autism is quite common as well, and ADHD is quite common. But I'm not going to say too much about the ADHD and autism because I'm not expert in that area, by the way. I'm just mentioning it. But I can tell you a little bit how people can present it. So, broadly speaking, mental illnesses can be of two types, and the third one is the personality dimension. Okay? Main one is which is the neurotic. Usually people present with some neurotic kind of symptoms, which can be anxiety and depression, OCD, obsessive compulsive behavior, phobias, right? And psychotic symptoms are the serious illnesses which should not be ignored. And if someone starts to have those symptoms, it should be addressed fairly quickly and earlier, because the longer and the chronic the problem becomes, it becomes difficult to treat. And there is obviously, when there is a difficulty to treat, there will be less response to treatment, and then the person can become more chronic and difficult to manage in the community and in the home environment, and in the employability can be less as well. Their function can be quite reduced. Personality and behavior, obviously we are all are different people. Everyone is different. We are so unique. We have different personalities and behavior. How we take things on a day-to-day basis is in our genetic makeup as well, our upbringing, our environment, lots of issues which actually lead to your personality building. Drugs and alcohol, which I want to say, and especially for the youngsters, that this has been a huge issue in the Western world, and also in our countries as well. But in this country, I see lots of people coming up with psychotic symptoms and depression and anxiety and other things alongside having some drugs and alcohol issues. So 3 types of functional. When I say functional, that means there is nothing wrong which you can detect through investigations like MRI scans or blood tests for these things, for these problems. Functional means something which more to do with emotions, behavior, and all those things. And if I say organic, just for the sake of the audience, that means something to do with the body parts. So psychosis, neurosis, and personality disorder. Different causes, inheritance as well. This is a well-known factor that the mental illnesses sometimes they run in families, and there is a high predisposition of having psychiatric issues if their family history is strong about the psychiatric problems. Okay. Upbringing is such an important aspect of your life and our lives and personalities, which can lead to how we take up the pressure on a day-to-day basis, how we cope with the stresses in our life, and how we function on a daily basis as well. So lots of things depends on your upbringing. Trauma, head injury can lead to psychiatric issues. Road traffic accidents and any other accidents can lead to infections like syphilis, HIV, and all those things can lead to mental problems. Nutrition problems like vitamin deficiencies can lead to psychiatric issues as well. Okay. Drug abuse, alcohol, cannabis, heroin, well-known thing, I think people are aware. Neurological problems like brain tumors, space occupying lesions. So those things can lead to psychiatric issues as well. And if there are some changes in our blood, in our metabolism, this can lead to psychiatric problems. Like, I'll give you a simple example. People who have thyroid issues, they have thyroid toxicosis or hypothyroidism, when their thyroxine level is not right in the body, so they can have either depression or anxiety symptoms. And strokes. If someone is having some form of stroke, vascular dementia, it can lead to dementias, and it can also lead to depression. Heart problems. Just to make my point once again, we all are different. We are different personalities. Like no one's thumbprint or fingerprints, they match with anybody else. So we're all different. So in neurotic scale, these are which I mentioned neurosis before, is generalized anxiety disorder. It can start with a mild or trivial form of anxiety, but it can lead to generalized anxiety disorder. When we say disorder, that means something serious. It's not just symptom, it's more than symptoms. And it is staying there, and you need to treat that. Obsessive compulsive disorder is obviously people, when they start checking things a lot, and they have some compulsive acts and quite a repetitive thoughts starts coming to their mind. So that leads to OCD. PTSD, Dr. Chaudhry mentioned earlier, post-traumatic stress disorder. So that can lead to actually psychotic symptoms as well, not necessarily just neurotic. Specific form of phobias, different phobias people have. People can have social phobias. Some people wouldn't even bother to come and see any big gathering, for instance. People can have phobias from the heights as well, from water, different form of phobias. In psychotic scale, this we call as a serious form of illness, and schizophrenia is one example. Schizophrenia and schizoaffective disorder, they are severe and enduring mental illnesses. Okay? And bipolar affective disorder can lead to psychotic symptoms. Not necessarily all the time there are psychosis or psychotic symptoms. Some can have without psychosis as well. Severe depression can lead to psychotic symptoms. So people, although they started with neurotic scale, like they were having mild anxiety or depression or something, and didn't have any psychotic presentation or symptoms, But if it is not treated, it becomes quite a resistant form of depression, and that depression leads to psychotic symptoms as well. So they can be out of touch with reality as well. They will start saying things which normally people wouldn't do. Okay. That's a lot of fun. Organic mental illness is, you remember I said that functional illness and organic illness. Organic illness is something to do with the structure or the part of the body. Especially we are focusing here into the brain. Okay? So Alzheimer's disease, like dementias are organic mental illnesses. Okay? And sometimes if there are some head injuries, acquired brain injury, that can also lead to mental health problems. Thyroid issues I mentioned earlier. So thyroid problem leads to. We have different type of infections. Exposure to infection or serious form of infections that can also lead to mental illness. Some people present with epilepsy, and we know that what epilepsy is. But epilepsy can also present with psychiatric issues. So you can't ignore epilepsy either. You need to evaluate when you're going to your doctor that, doctor should really ask about your mood and your perception as well, that because in epilepsy people sometimes can see things which are not there. Okay, now I think let's move on from problems, issues, different types of problems, how they can manifest, how to address the issues. So where shall we go for this problem to sort it out? So I think in this country, I'll say I've been working in NHS for the last 22 years. I think people are really blessed. We all the time say easily people can say that NHS is going downhill. But believe me, NHS is one of the best system as well at the same time. It treats everyone fairly. Everyone can approach it. It's not something which is we should take it for granted. People in other countries, they pay for everything. They pay for every little thing. So I think we are blessed in many ways in this country, in this system. Follow the local health system. Go to your doctor. First of all, first port of call is talk to your GP that if you have any mental health issues. I think the GP is the first one you should report. GP will do some screening on you. They will talk about some symptoms which are in relation to your daily routine, about your mood variation, your appetite, your concentration, your work routine, driving, how you're driving, has it affected that in any ways? So they will make a screening. So they will do screening and they will send to the mental health services. And the mental health services, because we are focusing in Slough and the house services are set up in this place, we have a common point of entry, it's called CPE. So they will make a referral to CPE, and CPE, which includes psychiatrists, psychologists, therapists, nurses, social workers, so they will assess you if someone is having mental health issues. And then they will pass it on to a person like me, that this person has a serious issue. Can you please check this person and assess this person and advise? So that's how it starts, that's journey. Private consultation is always an option, but the problem with the private consultation is it's costly. Not everyone is able to afford it. And also there is no continuity of care because lots of people who are actually working in NHS, they have a structured system. In the private sector, you can have a consultation, but not necessarily you can follow the whole, because in mental health is slightly different in that respect. You not only need consultation, you need a formulation of management plan, which lots of people are involved in. Okay? Self-education, self-awareness. Having some education within the families. So family therapies, counseling, those things, they are available as well. Once everything is evaluated, assessed, you need to have some treatment plan, and then you need to follow the treatment plan. This is the area which we struggle as mental health professionals because people don't adhere to the treatment plan. They either drop out, they don't come for the appointments, they don't take medication, they don't follow the guidance given, so that's why people do end up in these issues. Stigma and mental health, stigma and prejudice, every aspect of personal life can be affected. As you know, people don't come forward, they worry that what will people think about them, they will think they are crazy. I think this term is used so loosely, and you just label somebody and the person gets into isolation, doesn't come forward, and suffer in isolation. Even 2 out of 3 organizations which are set up in the community, because obviously it's not NHS which helps people. There are lots of voluntary and involuntary or statutory and non-statutory organizations which help people in the community. It's not just NHS. So they have also noticed there is a discrimination as well, and there is stigma. Some issues with the mental health problems require just medication. Okay? So they can be treated with medication only. Some need no medication at all. They would rather people would prefer to go for some psychological therapies, for instance. Okay? So they may be more suitable for psychological work and counseling. Some need both, and some need social structure as well, which is a daily structure, which helps in employment, which helps in the education, which helps in making friends as well, enhancing your skills, coping mechanisms. So all those, so everyone is at a different level, because we are all different, as I said. So and your needs are different as well. So comprehensive assessment is very, very important. So it's a biopsychosocial and spiritual model. Doctors, psychiatrists, is just summarizing what I said earlier. So biological and pharmacological treatment, of course, you need some psychiatrist who is more experienced than general practitioner in this area. So I would like to guide you that this can be medication. Of course, patient involvement and patient choice is very, very important. By telling them that this is the medication for this purpose, this can give this kind of side effects. That's important. Psychological treatment, obviously different forms of treatment. I don't want to go into too much details. Simply it's a counseling and talking therapy, which is on a cognitive behavior therapy model. So psychologists provide that, or therapists, they are trained therapists who provide that. Okay? Social health, family education, peers, employment, all those things. And spiritual, obviously, our imams, our scholars, they are also very important, I think, in this spiritual healing and guidance and improving your faith. These are some of the website addresses. I can even share these slides to you if they are helpful, so people can do this research on them. I just put this because this slide is too complicated, and I don't think you can read all of it because the print is quite small. I just want to make a point clear that lots of people who have mental health issues, they ignore their physical health. They start smoking, they start drinking, they do not look after their diabetes or cholesterol problems, because medications sometimes also can lead to higher or raised sugar level, raised lipid level, cholesterol levels. And if you are not in a habit of having a proper structure and not having much physical activities, you can end up having more issues with your physical health. So I think that's important. So this is just a repetition, really, that 1 in 4 generally people have. Okay, depression is of course the most commonest one. 1 in 20 will suffer from the severe form of depression. I think the last point I made it earlier was 5,500 suicide in UK in 2017, huge number. Some people end up in compulsory detentions in the hospitals because they can't think straight, they can't make decisions for themselves, and they're usually psychotic. So they can be detained under Mental Health Act, and capacity assessment is required because they have diminished responsibilities. This is just a slide for autism and ADHD. People can read it. I think the problem is quite well known. Boys are mostly who will come up for the diagnosis and things. The girls are not even diagnosed earlier because it's more common in boys. ADHD is also linked. About 30% cases of ADHD are in autism. Now, quickly, can you go to the MCQs?
We'll see if we have time. Can we?
Okay.
Okay, look, that's great. A wonderful presentation. I hope people would have liked it. You may remember something, you may not remember, but that's not an issue. What I would say is the most important thing I said earlier on is you. And that's why if we go to the MCQs, we will not be able to do the most important thing. I would simply facilitate. Dr. Sultan, you can bring the chair there and sit down and relax. We only have got 25 minutes before we break for Salatul Asr. In 25 minutes, I will request questions from no long comments because we don't have much time. We can do that after the Maghrib Salah. Dr. Javaid Sultan and Dr. Bassam will be here even after Maghrib for half an hour, so we can have those long personal private consultations afterward. Now is for the learning purposes. So one question from the men's side, one from the women's side, our sister side, or my daughters and my young people, my son, and I will facilitate that. And let's start from our sister side, and whichever side asks more questions are the winners. So there is a competition, and Dr. Javaid Sultan is so experienced, he will try to give a quick sort of answer, but it's not a time for a detailed discussion, as you can imagine. So my sisters, my daughters, who would like to go first? Yes, please. English, if some people prefer Urdu, even Arabic, so we can manage 3 languages. English, Urdu, Punjabi, 4 languages. Yes, please, go ahead.
Thank you for the very informative talk. Doctor, CPE का आपने बताया था, that is also through GP या हम direct CPE को approach करते हैं?
जी, CPE is, as I said, it's a common point of entry. CP के लिए usually you need a referral from a GP. If you don't have a history of any mental health issues, CP can triage you over the phone, but they will advise you that you should better see your doctor first.
So CP number is also through GP. You can get contact or a walking center in Slough.
Every GP surgery have the common point of entry number, because they prefer that they will make a referral, because the referral in the common point of entry does not only come from the GPs. It comes, Dr. Chaudhry, if it's okay if I can stand so people can. Yeah. So obviously the CP is a main place where everyone is referring. And the referral comes from the various sides, from the GPs, from the social services as well, from the police station as well, right? And sometimes from the crisis team, like the crisis team, you having some issues that they will say that they will make a referral to common point of entry, or common point of entry will make a referral to crisis team. So, and from the hospital, it can come to the CP as well. So I think usually they prefer that the referral is coming from some professionals.
From brothers and young people, Umar Ansari was the first one to raise hand. Please forgive me if I have not sort of allowed you for, because he raised the hand first. Then, yes, Umar.
Thank you, Jazakallah khair for your talk. I work in mental health myself. There's a lot of stigma attached to mental health in our Muslim community, could be Pakistani, Arabs, Somalis, other communities. 2 questions, a 2-pronged question. Basically, the first question is, should there be any embarrassment attached to mental health in our communities? Secondly, how do we overcome the stigma attached to mental health in our communities?
So embarrassment and stigma regarding mental health.
Well, I think should there be any embarrassment is something we need to ask ourselves after listening to all this, that why we need to feel embarrassed about. Because if we are not dealing with the issues, and this is for my sisters and for everyone, that if we are not dealing with the issues, this is not going to go away. It's just going to go more complicated, more problematic. And maybe you are ending up and seeing somebody who is not professional to handle that kind of issue, and that can misguide you and mislead you as well. So I don't think that you should feel embarrassed at all. And this is my message to you, that please come forward if you have any mental health issues. And the second question was about
This is stigma.
About stigma, how to tackle stigma. I mean, it depends on lots of factors. Stigma, how you tackle with stigma. I mean, what's your upbringing is like? How's your family culture is like? Which country are you from? Do you accept illness as a whole or not? Do you accept, even men sometimes they don't accept any problems as compared to women. Women underreported because they are so busy in their domestic life and things. But men do not accept generally that they have any mental health issues, and they keep on working, and then becomes more problematic because it's difficult to handle. Tackling stigma is not easy thing. I think we need to raise awareness that mental health, what it can lead to. So if we are raising awareness amongst our community, amongst our circle, social circle, to our children as well, we should be available to talk, available to listen to people, because sometimes the barrier is there when we are saying, okay, this is nothing, you are just making it up. So people then think that this is a barrier and they think I'm going to go crazy. There's no need to say those words. People use extreme words, for instance. Sorry, I'm just finishing up.
Yeah, can I just add on to that?
Yeah, sure.
I think the stigma is not so much embarrassment, but I think it's confusion. Because as Muslims, how do we see mental health? Because in the Quran, as Muslims, we're told, hang on a minute, if you've got mental health issue, it's because you're weak in your deen. Practice your deen, read the Quran, and you'll be alright. So the question is, how do we correlate between mental health and the deen? Because if you go to any other doctor, they'll say, oh, there's no, science doesn't talk about religion, and there's no mental health in religion. So I think it's more, yes, I agree, it's embarrassment, but I think it's confusion. Because we don't come out because we think, okay, we've got mental health, that means we're weak. Because our Prophet, he went through down, he was very low at one point in his life. Where did mental health come into it?
I think you made a very valid point, and I can only say that stigma is such a big word which includes so many things. Confusion is obviously part of that as well. But embarrassment, you cannot say that there is no embarrassment. People do not come forward, they don't accept because they feel how people will perceive them. And so that's why they feel more embarrassed as well. They don't admit issue. So there is a confusion, I can understand. I'm not really expert in the religious side, which Dr. Bassam will mention a few things from the spiritual healing.
We will have a sort of an azan break in a minute. And I think the mental health, the people of faith are not immune from mental illness, as simple as that. If anybody tells you, even the greatest sheikh or the greatest imam, it is not something to be comprehended or believed because it is not true. And it may be linked with the weakness of faith or may not be linked, but the most important thing is the stigma. Everything is important to raise awareness and educate yourself, number one. Number two, Allah has given us the rational faculty to move on in a life. It is a great oppression and a dhulm on our own rational faculties that we do not sort of move forward. We need to open up the options that how I can deal with that. And this issue will be addressed by Dr. Bassam Afisa. So we'll just take a break for 2 minutes, you see. Some housekeeping again. Looking at the time is the biggest resource is running out of our control, and we've got exactly 14 minutes to actually complete the first session, but do not worry, we'll have plenty of time after to ask questions. We'll continue our question and answer for the next 14 minutes. Now the turn is from the ladies' side, but before that, Dr. Bassam Saleh want to give a very brief comment regarding the stigma.
Assalamu alaikum wa rahmatullahi wa barakatuh. I would like to listen to this question, comment, after the second presentation, inshallah, because this is probably one of the main themes in the presentation. That's my comment.
Jazakallah. So we'll discuss that, come back to stigma. It's ladies' side now, then Ikram sir. Yes, please.
How do you get help for somebody that wants that they've got mental health issues or want to the GP?
It is the key question. If I want to give the number one question is, how would you help those people if they have a problem and they are in a complete state of denial to go to GP or seek treatment or listen to anybody? And I'm sure many sisters and brothers would have the same question. It's a difficult one.
Thank you very much. This is really a difficult one to manage in terms of the management, because the person does not have understanding or insight, and again could be stigma as well. Okay, or the illness is to the extent the person is not thinking straight and does not believe there is anything wrong with the person. So we do come across these kind of issues on day-to-day basis. If you have someone who has this kind of issue, obviously as a family you need to be aware that we should not just leave the person alone or thinking that after a few days will be fine. I think first thing is to discuss with your doctor, and doctor will make a referral, as I said, to the common point of entry. We do have some professional, loyal, dedicated member of staff who can visit at your home as well and try to talk to that person separately or alongside the family members. It's not always easy. Sometimes just having some contact and not taking medication is also important, because the person who is involved in the care as a professional will give you some advice how to deal with, for example, the person is talking in a loud voice or becoming very, very aggressive, how to manage. So this itself is so much which requires some education to the family and friends to deal with the day-to-day situations. So my point, my answer to your question is, don't ignore it and don't stay quiet, just seek professional help. And the person will advise you after assessing the situation what kind of intervention or help can be helpful.
And we will come to this area probably in the main panel also, because this is a question which is very wide. I also make some comments to that. Ikram sir, apologies for waiting. And after that, from this side, then...
I have an environmental health problem. I've been coming with Muslim for over 20 years. And I have not solved my problem, in the masjid. How can I solve those problems? I have a mental problem in the masjid, with other people, and their teaching or their behavior. It affects me sometimes, and I sometimes lose my temper at the same time, which sometimes when I meet myself, I should not lose my temper. If they are behaving like this, how should I control myself?
Shall I rephrase, or are you okay with that?
No, I'm fine with that. Thank you very much. I think you are very brave. You admitted. First of all, thank you very much. You admitted you have an issue.
Yeah, senior most committee member.
Okay, and you said that you have a. I'm just trying to summarize it. You are saying that you have an issue with managing your temperament, and this is secondary to the reasons when people in this environment, they are making you upset. So at least you feel that people are not caring for your comments, or your presence or the environment around you. So I think the best thing really is that you should talk amongst your committee members that this is something which you're having an issue and how to tackle it. This is not one thing.
If they have the same problem.
If they all have same problem, it's a group problem. So we need to have a group therapy then. So I think that needs a group therapy. And I mean, joke aside, so we can always have some workshop like today about your behavior, your coping mechanism, coping strategies, how to manage anxiety, how to manage your anger, which is, I mean, happening due to the situation and the environment you are in. So we can arrange that. But no treatment, no medical treatment for that.
Sister side now, because we did say we'll have equality.
I just want to add.
Okay, yeah.
Most of the GP now, they've got anger management counselors. So if they, Mr. Kram Saab can refer and speak to his GP, who can refer him to the anger.
Can they not come here? Okay, the brother works in mental health and he's saying, and it's true, you're absolutely right, there are a lot of mental health GP surgeries and all organizations we're doing everywhere in the anger management now. Because we become very angry people, the whole world is very angry because it's driving us towards that anger. And yes, people can refer to a GP. So, and you can also directly refer to other organizations. And there are some free organizations who don't charge money. They're Islamic, like Samaritan, Good Samaritan. So for anger, people can. And it is brave, actually. From sister side, now then from men's side. Any question from this side? If you do not say it in 3 seconds, the turn will go back to the men. This gentleman asked, sorry, the second row, yeah. You're late now. Yeah. We'll do after the main panel, yeah.
We've talked a lot about mental illness, which is a diagnosable condition, but you haven't differentiated between mental health and mental illness. A lot of the time, a lot of our issues can be resolved just by someone listening. You don't need solutions all the time. Most of the time, a lot of our issues are due to not being able to someone to speak to you. They don't need to have the solution. All you want is someone to listen to you. There's a big difference between illness and health, because you've talked a lot about ADHD, this and that, but what about the everyday issues that people are dealing with?
Yeah.
They don't need to go to the GP for that.
Yeah. So mental health is obviously, thank you very much for the question. Mental health is obviously everything. Mental illness is part of mental health. And small issues, behavior issues, environmental issues, work issues, they can be issues with the mental health problems. But that does not mean that everyone has a mental illness, as you rightly said. And those needs to be addressed, obviously, by listening techniques and communication, supportive counseling, and those things. I am not denying the fact that people do not have those kind of issues, but those are not mental health issues. Everyone can have them because of our personalities. We have a different ways of managing things and different ways we cope with the situation. The person, it can be just your brother. You can be very strong and you will deal with the situation very effectively, but your brother might feel a little bit anxiety provoking, feel anxious, and he might need help. So then if it leads to that direction and it becomes severe, that can lead to mental illness. So I think mental health issues are there, but they're not necessarily having mental illnesses. But some things, as you said, they can be dealt at just simple listening techniques, relaxation techniques, breathing exercises, coping mechanisms, supporting each other. I agree with you.
And awareness is the most important. Okay, so sister side, and then this gentleman sitting in the front. I'm not in a sort of, this is not a nice job what I'm doing. I'm not feeling very good about it. Sister side, your turn now. Question, English, Urdu, Punjabi, Arabic? Yeah. If you ask more than one question, you will have to pay us £5. Please go ahead, Dr. Henna. Yeah.
No, I was saying like Brother Uncle Ikram mentioned about, so there are triggers. So I think, isn't it like a two-way thing? Even if the family knows, जैसे घर वालों को पता चल गया कि इस ट्रिगर से इनको गुस्सा आता है, अब हम मस्जिद वालों को पता है ये इकराम साहब को क्यों गुस्सा आएगा, पार्किंग गलत हो गई है, टिश्यू लोगों ने टॉयलेट में फेंक दिए, बच्चे बड़े शोर मचा रहे हैं, तो to reduce the triggers, और फैमिली भी फिर ये करे कंसिडर कि भाई अगर फाइनेंशियल मैटर है or something which triggers the other person, So does it, how much is the role of the trigger? That's what I was asking.
Yeah.
If somebody already has a genetic reason or the hormonal imbalance, obviously जैसे brother was saying कि faith में नहीं हो सकता तो लेकिन अगर hormonal imbalance है तो वो तो faith में भी हो सकता है ना. तो the triggers will perhaps stimulate some people more than the others. कि जिनकी already factors हैं, they will be affected more. They'll be more prone to the triggers. Is that right?
ये बिल्कुल ठीक है आपकी बात. और मैं अकराम साहब को बड़े अच्छी तरह से जानता हूँ. इनका बहुत पेशेंस है. और अगर ये थोड़ी किसी वजह से इनका टेम्परेचर ऊपर नीचे होगा तो लोग इनको तंग कर रहे होंगे. वो जाहिर है कि कम्युनिटी में ऐसे इश्यूज होते हैं. तो जाहिर है कि इसमें एक बंदा ही चेंजेस नहीं ला सकता. दूसरे लोगों को भी लर्न करना पड़ता है और कोऑपरेट करना पड़ता है लाइक ए फैमिली. इकराम साहब की एक फैमिली अपनी है जो कि घर में है. उनके साथ इनके इतने इशू नहीं होते होंगे. यहाँ के अगर इशू डिफरेंट वाले हो रहे हैं तो ये भी एक फैमिली है. कम्युनिटी में सारे जो मस्जिद की कमेटी है वो भी इनकी फैमिली है. उनको भी अंडरस्टैंड करना चाहिए और इश्यूज क्या हो रहे हैं उसको रेक्टिफाई कैसे किया जाए. आई एम श्योर दे मस्ट बी डूइंग इट. तो लेकिन मैं उसके ट्रिगर्स आइडेंटिफाई करना बहुत इंपॉर्टेंट है कि किस किस वजह से अगर बत्ती खुली छाड़ती बंदा होते हैं नहीं तो वो ज़ाहिर है वो गुस्सा करेंगे. वो ट्रस्टी भी हैं, वो कहते हैं बिल को आ रहे वो लड़ाई भी होती है उस बात पर. दरवाजा खुला रह गया, एसी चल रहा है या हीटिंग चल रही है और ऐसा कुछ होता है. तो ये सारी चीज़ों को कलेक्टिवली करना पड़ेगा. तो मैं इसीलिए वो जो शुरू में ये ब्रदर ने बात की कि एंगर मैनेजमेंट, मेरा नहीं ख्याल कोई एंगर मैनेजमेंट का ऐसा इशू है. वो सिर्फ ये है कि अंडरस्टैंडिंग डेवलप करनी पड़ती है कि वो बंदे को थोड़ा सा इस बात पे गुस्सा आ सकता है या थोड़े से एजिटेट हो सकते हैं बिकॉज ही इज़ मोर डिसिप्लिन. वो चाहते हैं हर चीज़ डिसिप्लिन तरीके से हो और दूसरों को भी करना चाहिए. कई दफ़ा कोई लोग कहते हैं कि ये ज़्यादा डिसिप्लिन हो गया तो वो तो फिर अपनी अपनी एक अंडरस्टैंडिंग. लेकिन ट्रिगर्स आइडेंटिफाई करना चाहिए.
लेकिन आपकी बात वो एक पॉइंट बड़ा अच्छा आपने रेज किया है कि फैमिली को भी जो है वो थोड़ा सा सेंसिटिव होना चाहिए. देखिए ये सारी बातें सिंपैथी की हैं कि अपने लिए तो इंसान कहता है कि सारी सिंपैथी मनु ही मिल जाए. डज एवरीबॉडी अंडरस्टैंड उर्दू पंजाबी और नॉट रियली? दोस हु डोंट प्लीज रेज योर हैंड. Aziz, you are not allowed to raise your hand. Just one person. Okay. I think we have to go back to English. Look, the point Dr. Hina has raised is all been addressed, but I think the one point I want to sort of reiterate and re-emphasize, it is a mutual responsibility of all the members, whether the community or whether the family members, sons, daughters, and mothers and fathers and mother-in-laws, and so on and so forth. So that is something which we need to address at home, that we are one team. We have to look after each other. We have to care for each other. It's not that only the husband wants or a man wants, see, I'm the most important, or the women say that I'm most important, children say. So I think that is a wonderful opportunity in this time of the world where we're living in. That we all sit down and have family meetings. I prescribe and sometimes I beg people to have your family meetings at least once a month, like a round table. Nobody's a chair, nobody's a chief executive, and say, just go around, how is life? What is happening? What is the plan? That's it. Open questions. Not, oh, you did that or you did that. That is a problem in our families. And a lot of time the cases and the issues are resolved just by sitting down once a month. Twice is better than once. Inshallah ta'ala, we are breaking now. We got 5 minutes for Asr. Some people might need to do wudu. So I think you're free to go and leave and come back and have your refreshment and pray your Asr and come back and we'll restart 3 p.m. Is there any burning question? The small one, short one, mini question.
It's just that I want to be able to come out.
People, if you want to go for wudu, please you can go.
Yeah. I just want
Asr
to
is 2:45.
That thank you for arranging this, and I sit on Slough Wellbeing Board. But what is it that you are doing, and we all need to do to engage the community? Because it's, you gave statistics there, 1 in 4, but I think our community's got more.
Yes,
issues, bigger issues, especially mental, because we're in different dimensions at different times. So what is it that we can do to engage the community, to educate how to come and ask for help? And we see it, I don't know if you may have some figures from within the community, how many people are referred, because I don't think there will be many because of that stigma. We as a council wants to engage and needs to engage, but we need some help.
I will say 3 things with that we can do. One is we need to strengthen, reinforce our family. That is through meetings, that everybody is important, not just one person. And the second thing is strengthening of the institutes. This is an institute. Strengthening of institutes and involving, knocking at every masjid committee door. What are you doing here? The mosque is not only for the prayer. That is the strengthening and involving them. And the third thing, which many people or our sheikhs or imam might not like it, train the trainer. Train the trainer. People who are sort of, in some positions in the mosques and they're saying that is it. They don't need any training. Everybody needs training. I believe I would need training for many things until the day I die. And anybody who says, I do not need the training, that is a problem. So your point is extremely valid. And I think that's what it should happen. So the strengthening of your family, start meeting, and strengthening and of the institutes. It's not that they become improve themselves. People have to cooperate with them. They're running the show. They're sort of having sleepless nights. So inshallah we will come back. So let's not sort of keep your questions. We'll have plenty of time.
Just add to your. I think you rightly said that it is underrepresented in our community, and it's lots of reasons. Because again, I don't want to go into those stigma and not awareness. But talking about the figures, the last 2 years, because I work in Slough. So last 2 years, in common point of entry, for instance, the people who were referred to us were 695, and this is the exact figure, by the way, I'm telling you. And out of 695 in a year, which were referred to mental health services, I think 1/3 of the referral was from our community. And when we know very well, then Slough is, predominantly our own communities. So that means underrepresented. And referral is not as much as the white population or other ethnicities are. Thank you very much.
Thank you.
Thank you very much for coming.
See you soon.